Hello, welcome to Library Lights, the new podcast from the Knowledge and Library Service at Somerset NHS Foundation Trust. I'll call us the KLS for the rest of this podcast. I'm Veronica Price, one of the Knowledge and Evidence specialists based in the KLS at Musgrove Park Hospital.
And I'm Megan Calvinek, the Knowledge and Evidence librarian.
We're launching this podcast because we want to help everyone understand what we do and how we help our colleagues. We have physical library spaces in the academies at Taunton and YDH, but we also offer all of our services online. We hope that over the next few months, this podcast will help raise awareness of the many ways that we can provide support for our colleagues through the entirety of their careers here in Somerset.
We are also hoping to dispel some of the misconceptions that exist about the library. For example, we don't go shushing our users, we don't charge fines on overdue books, we're not just a room full of books, we also have computer spaces, and we're not just here to serve the medical students or just here to serve the doctors.
Basically, the KLS exists to provide evidence and learning resources to every colleague here at Somerset NHS Foundation Trust, whether you're medical or non-medical, whether you're full-time staff or a student, and whatever your level of experience. Over the coming months, we'll tell you about all of our offers. We'll bring you interviews with library staff and some of our colleagues who will explain how the libraries help them to practice evidence-based patient care. So whether you're listening while out on your morning run, or as you drive to see a patient out in the community, or maybe you're at the end of a long shift, we hope that you'll enjoy learning about the KLS. We'd love to hear from you, so if you have any comments or any questions that you'd like to ask us, please email us at librarytraining, that's all one word with no punctuation, at somersetft.nhs.uk, and we'll put that web address in the show notes.
This week, across the library profession, we're celebrating the Green Libraries Week. So today, I'm delighted to welcome Isabella Fisk, a sustainability champion facilitator for the Sustainability Working Group here at Somerset, to talk about sustainability at SFT and ways in which we can make our green spaces greener. Hi, Izzy.
Hi.
So for starters, do you want to talk a bit about your role with the Sustainability Working Group and sort of what got you started with the sustainability community of practice?
Sure. So I've always had a passion for sustainability and kind of eco-friendly action. But since I started in the NHS, I kind of wanted to explore how that can be applied to healthcare and each different service within that, to encourage staff as well as patients to be involved with that kind of process of ensuring we actually have a healthcare system in the future. You know, it's sustainable, it lasts the test of time. And I kind of noticed that there were little pockets of action going on in the trust. So people were doing bits here and there, you know, primary care, some work going on in CAMS, different, like a few nature-based approaches, quite a lot with the head of sustainability doing things with estates and things like that. But there wasn't really a joined up approach or a space where any staff member could kind of come and, you know, talk about sustainable practices, bring any questions, queries, get advice and have the support of other colleagues to kind of actually get projects done. Because a lot of it, I realised, was sort of conversations about sustainability, but things weren't actually happening and there were barriers there. So I kind of wanted to create a space where anyone could learn more and come to feel like they're really making a difference. Yeah, because I think, I mean, my opinion really is that if healthcare is our job, then tackling climate change is our job and supporting the environment is our job, because health isn't just human health, it's environmental health, and we're totally reliant on that. So
yeah, I've had the pleasure of attending a couple of the Sustainability Working Group team meetings, and there really is that culture of like shared learning and just people willing to help.
That's good to hear. That's the aim. It's what I like to hear.
So on the topic of sustainability, are there any projects that you're particularly proud of?
Yeah, so last year in September 2024, some of us from the Sustainability Working Group created a webinar series. So it was kind of under the umbrella of nurturing nature in the NHS. And the aim really was to help people's education and awareness about that topic in general. We had, I think it was an 8-session series. So we had topics like sustainable mental health care, nature and neurodiversity, green social prescribing, that kind of thing. And I think I'm particularly proud of that one because we had a lot of guest speakers. There was people from Somerset Wildlife Trust come to talk. There were experts by experience. So, for example, there was a lady who was autistic and she had developed her own gardening group for people with neurodiversities. And just other experts by experience and people that had really, found something meaningful with nature and they'd interacted with it and it really helped their mental and physical health. So it was so lovely to hear from them. We've done quite a lot of projects really as part of the group and I'm proud of how far it's come in such a short space of time. But more recently, obviously with yourselves, we have next week we'll be launching a couple of seed libraries in our acute hospitals for staff to engage more with nature. And that's as part of Green Libraries Week, which you'll know more about than me, but it sounds fantastic.
We will. You have made us some lovely boxes for the seeds to go in. And I'm not as good as making boxes, but I'm quite handy with a crochet hook. So I've crocheted 2 little seed monsters to go with them.
I love them. They're so fun.
And yeah, they are very cute. And we will have some sort of like sustainability, well-being books to go in the collection. And we were really lucky and we received some funding from Luz Musgrave. So we've been able to buy some cute miniature sort of like terracotta pots and a couple of really good books that you suggested from sort of RHS and the Wildlife Society. So they're really good quality books that I'm really excited that people will be able to borrow.
Yeah, I think it's particularly important to kind of help people have access to some of those books. We are financially, times are quite hard, so it's a way to help with that accessibility for staff and learn more about how they can connect with nature to support the environment and their well-being at home really easily. And also, if anyone's interested in coming along, I will be bringing free plants as well. So that will be another bonus
to give out. That is very true. And we will also be having a giveaway of, I think there were 10 of them, of the calendars. And we'll also have some posters that will go in the collection that talk about growing seasons for different plants. And they've got a really good section on like bad companions and good companions. So I'm very excited to get those set up.
That would be good. How-to guides.
Yes, exactly. So in terms of, obviously this will be about connecting with nature and green spaces, and I think it's really important that we're able to make those pockets of green spaces at work. So my next question, which leads in nicely for you, is how can we connect with nature in the workspace?
So this is, there's so many ways to connect with nature, even if you're stuck indoors, which sounds a bit strange, but there are ways. And I suppose to sum it up, the University of Derby coined this kind of 5 pathways to nature connection, which is a really easy way for people to just have that instant connection and a pathway, as it says, like a way in wherever you are. So the 5 pathways are contact, beauty, meaning, emotion, and compassion. So they're just ways, beauty, for example, might be you've noticed the lovely colours of the autumn leaves, or meaning is something that's, I walk my dog in nature every single day and that has meaning for me and I really enjoy that and it feeds my well-being. It's that kind of thing. And there is a really good free course that they do to tell you more about that on their website. So I would recommend that to people. But in terms of what you can do to learn more about that, and actually in Somerset FT specifically, that's another project that we have kind of done from the Sustainability Working Group, is developed an e-learning course. So again, it's called Nurturing Nature in the NHS because I love alliteration. But that basically came from the webinar series. So you can watch those recordings, but there's an e-learning course that makes that more interactive and helps people learn how you can connect with nature in much more detail than I'll talk about today.
And if I'm not mistaken, when you complete the e-learning course, you do get a fancy green background to use for Teams.
Yeah, you do. That's part of the Green Time Before Screen Time campaign. And the idea is just to encourage people to have breaks in between and before.
Look at trees.
Yeah.
Very good. So obviously nature in the NHS is quite important to you. So in terms of just making it accessible for people, what are like 5 quick ways that we can sort of like green up our workspace?
Yeah. This can be difficult because it can really vary, and you know, our environments, some of them are much more able to have things like plants, for example. That's a really good way. You can have indoor and outdoor plants. But taking our acute hospitals, for example, there's some departments where there's no windows because they're completely in the centre of the building. So it's just kind of thinking differently in those spaces, and you know, plants all have different needs of their own. But that's one good way, is houseplants. But just a fun tip, well, maybe not fun, but a helpful tip is that to try and stay away from pollinating and flowering plants for indoors, because people have allergies and we don't want to set them off. So succulents and cactuses and things like that are good. Another one is kind of bringing nature in through imagery and colours. So I've seen this done with, you know, pictures on the walls, or kind of murals painted on walls and spaces. Sometimes even just the colours of the furniture and things like that can actually make quite a lot of difference, not just to staff in their offices, but also for patients. You know, say if we take an inpatient ward, for example, they're noisy, busy environments, and actually a lot of people really just need that quiet space, and sometimes having calming colours around them can really help with that. So that's quite a good example of a way to bring nature in. I would say also optimising natural light where possible and minimising artificial lighting. You know, this varies on team needs. Some people's eyesight, for example, is poor and they need artificial lighting to help them, but for other people it can give them headaches and things. So it's trying to work out what's best for you and your team, but ideally optimising natural light is helpful, especially if you do have plants in your office. Another good idea is having meetings outdoors where possible, and things like walking supervision. So just in terms of a personal example, my previous supervisor and I would meet up and walk our dogs and have walking supervision, where we would be very careful about confidentiality if we were discussing any clients, and we would have a bullet point of notes on our phone so we could then type up what we'd spoke about back at the office. But that was such a lovely time, and we felt much more able to be open with each other, walking side by side in nature rather than sat across in a kind of room with just white walls. So the final one is again kind of an attempt to get staff outside, but that can come in lunch breaks, which people probably take, but they probably take them a lot in front of their computer.
I'm very guilty of doing that.
Yeah, it's easy to do, but I would really encourage people to just have a little look around wherever your office space is, and any green space you can find, to just go and sit, even if you're not eating out there, but you're just having a quick break, to just step away from the screen. And again, maybe going back to those 5 pathways, engaging with that, just what do you see straight away, what can you hear, what can you feel, what can you smell, that kind of thing. So yeah.
Or
So,
popping
yeah.
down to the library, getting a book and reading outside. That is always a
yeah,
good way
that
of
would
doing
be great. 2 in 1.
So if people are interested in getting involved in sustainability in the trust, like I did when I reached out to you at the first point, what are ways that they can do that?
So there's quite a few options. One thing people can do is obviously join the sustainability working group. I run the group monthly, and it's on a drop-in basis, so there's no pressure. If you join, there's no pressure to come every single time. You know, I don't want it to be an extra thing that people feel stressed about in their role. So just contact me and I'll send you the joining information, and whatever, you know, as little or as much as you contribute is good. The more you contribute, the more you probably get out, but it's completely personal, so that's fine. Another option is people can become a sustainability champion like I am. So it's really easy to do. You just approach our head of sustainability, which I can put you in contact with him. and sign a form, get that approved with your manager, and then it's a bit like being a wellbeing champion, really. So you just try and get that on people's agendas, try and encourage your team members to be involved with things, and you can make it really fun. You know, like before, I've encouraged everyone to wear something green on Earth Day, for example, and just little things like that to bring it to people's attention and have those conversations. There's also a sustainability intranet page, and now that the intranet's all been redone, and we've added a kind of nature section as well to that, there's a lot of information on there about what you can do within the trust and what's been going on. So there's no need to feel like you have to reinvent the wheel every time. You know, you can get ideas of something that's worked in another department and do that in yours. And I guess another helpful thing would be obviously to complete the e-learning, but there's not just the course that we created, there's 4 other courses relating to sustainability as well. So it's just helpful to do that to get you kind of having a basic knowledge about it all. And that will point you to the green plan as well that we have in the trust, which is a helpful document to read and hopefully inspire people.
Absolutely. And any links and contact information will pop in the description just so people know where to reach you.
Yeah.
Just in case.
Brilliant.
But thank you very much for coming on. It has been lovely talking to you.
Thank you.
And it's been really good to sort of hear, even though I know we've spoken before, but it's always really good to hear how people can get involved and what goes on. There's more than you think when you think about sustainability.
Yeah.
And it's a lot easier to make sort of those pockets of green spaces than one thinks. Just adding a plant onto a desk makes a big difference. I think.
Can be small. It can be small, but like you said, it has a big impact, and the ripple effect, usually, you know, you can't always see the impact, but it doesn't mean it's not there.
No, exactly. Thank you very much.
Thank you.
So after that delightful discussion, we are now going to move on to the KLS Resource of the Month. And here to talk about our wellbeing collection is the library manager, Kate. Hi, Kate.
Thank you, McGann. Yes, hello everybody. I'm Kate. I'm the Knowledge and Library Services Manager, and I'm really excited to be part of our first episode of Library Lights. Thank you very much for having me. So I'm here to tell you a little bit about the wellbeing offer in our libraries. One of the many hats I wear as a manager is that I'm one of the Trust's wellbeing champions. My team and I are very passionate about creating library spaces and resources which are inclusive, and so that libraries can be places of sanctuary for colleagues, as well as for learning and study. So we have wellbeing resources in both of our physical library sites at Musgrove and Yeovil. And for example, the resources that we have include fiction, non-fiction and poetry books. We've got self-help books, including the Reading Well on Prescription titles, which are books that are recommended by the Reading Agency, who work with other agencies like the NHS or kind of dementia awareness groups, etc. Our jigsaw puzzles are very popular, and we've also got crossword, Sudoku and colouring sheets for mindfulness activities. We've got a couple of regulars, certainly in Musgrove, who come in to do the puzzle. And they just come in and they just quietly take a seat at the table where the puzzle is and just quietly work away on the puzzle. And occasionally I just interrupt them just because I'm really chatty like that and just ask them if they're enjoying themselves. And they've told us how much they appreciate being able to step away from the busy wards and just clear their heads and sort of just have that space and that time to kind of just get all the showy head, as a colleague used to say. So I know that's really appreciated.
And these resources can be borrowed by anyone in the trust, can't they? They're welcome to sort of
they can.
take a puzzle or a wellness book with them. You don't have to read it in the library. They can be enjoyed at home as well.
Exactly. And if you work out in the community, for example, you can request books. Just contact the library. We can post them out to you in the internal post. And we've also got a page on our website which describes our wellbeing offer, and it provides links to other kind of online resources as well, like apps you can use and other podcasts like this one. So yeah, plenty of ways to interact with the wellbeing resources. It's not just books. We've also, thanks to a shared initiative with the public libraries in Somerset and the public health team in Somerset Council, we've also got sets of individual blood pressure monitoring kits to loan out, which was a bit of a step out of our usual traditional resources that you'd find in the library. So we got these just before Easter, I think, this year. So each library has a set of 10 blood pressure monitor kits. So this is really useful, for example, if your GP asks you to monitor your blood pressure, but you don't necessarily have the right equipment at home. you can borrow a kit from us just like you would a library book. And
That's
again, we
amazing.
can post those out as well. We've had a few of those go out and people have been really appreciative of that. They haven't had to go to the GP and use the scanning machines in the reception and all the rest of it. So it's been really interesting to be able to add that to our offer as well.
Yeah, I would have loved something like that. We had to buy my grandfather one because otherwise it would have been a hassle trying to get him to the GP every day, twice a day to take his monitor. So, yes.
Yeah, so it's just another little way we can help. And as kind of been mentioned already on the podcast, thanks to funding from Love Musgrove, we've now got a few books about gardening to add to our collections, as well as our Seed Library initiative, which you've obviously heard about on the podcast today. We're all very excited about that. I'm personally not very green-fingered, but I'm willing to give it a go. I think everyone's got to give it a chance, haven't they?
Yeah, I did have to laugh when I'm the person in the library who kind of ran with the seed libraries, because back in university I managed to kill an aloe vera plant, and they're meant to be like indestructible. They're meant to be like you can leave them, and I don't really know what I did. I think I might have overwatered it, but when Izzy and I were talking, and I was like, I love the seed library. I think it will be more, I'm going to try and make a green space at my home office. I'm not sure how it's going to go, and I might just send Izzy photos of really sad looking plants, but I'm hoping it will go well.
Oh, but hopefully we can build a bit of a community around that as well.
I think that'd be really
share
nice.
The pictures of how their plants are coming along, get advice, particularly for people like me who are not so good at gardening, and hopefully we can build a bit of a community.
Yeah, we're going to have a little section where people can talk about sort of how they've used the seed library as well, and even any comments that they want to make. So we've made like an MS form which will link near the seed libraries as well.
Oh, well, that'd be great to see it literally flourishing. Would be amazing. Yeah, so really looking forward to that. So we've also in the progress of developing a patient library offer as well. So providing books that patients can borrow during their stay with us, as we know that reading is good for the mind and soul, and it could be a really good distraction, especially if you're lying around in a hospital bed. So these are just relying on donations from colleagues. So we've kind of got a couple of different genres. We seem to have an awful lot of Clyde Cussler books at the moment.
Yeah.
If that's your thing, please come and help yourself from the library. They don't go out through our usual borrowing system. They're just free to take away. People can take them home with them. So if they've hopefully made a full recovery and on their way home, they can take their book back home with them to finish it. We have no expectations of bringing it back. Just kind of relying on karma, really.
Yes, I have heard through the grapevine that historical romances are
we have
in short supply but in high
yeah.
request. So if anyone has any, or just any books in general that you would like to bring to the library to donate, either at Musgrove or YDH, we would be infinitely appreciative.
Yes, that'd be great. Love Musgrove have actually funded a special trolley for us at Musgrove, which we're hoping to be able to take out onto the wards as well. And then we can really get the books circulating as well. So really, I'm very excited about this trolley. It's such a geeky thing because it opens up and it's like bookshelves on the inside. It's like, oh, amazing.
It is a very cool trolley. It's very big, but it's really cool.
Yeah, thank you, Love Musgrove. And while we're talking about reading and how it's good for your health and everything else, we do have a book group that meets regularly online. It's called Bookends, which I believe you'll be hearing more about in just a second. So that's a really good way to kind of share that reading passion with other people. And they read some really interesting books. So yeah, do get involved with that if that's what you're interested in. I think that's kind of all I have to say really. I only had 3 minutes, I've probably gone over that.
No, thank you very much for coming
just
on.
to
It's
say,
been really nice to have different voices in our first episode.
Yeah, but we're really passionate about wellbeing. Certainly I am. I've been a wellbeing champion in both trusts that I've worked in. And as a service, we're just here to support you as a whole human being. We're all more than just our jobs and roles, and I think looking after yourself, especially if you look after others, is really important. So yeah, we're always looking for suggestions for resources. So if there's any other ways you feel the team can help support your wellbeing, then please get in touch. And thank you.
Thank you very much.
So I'm going to talk just a little bit more about the Bookends Book Group, because I have the great pleasure of hosting that each month and organising it. So Bookends has been running for about 6 years in the Trust. I've been running it for the last 4 years. It's open to everyone working or studying at Somerset Foundation Trust. And basically, research into reading fiction shows that it can increase your levels of empathy, it helps you step inside another person's life, another person's situation. Recent research has shown the kind of increase in bonding between parents and children when they read books together. And just generally, reading contributes to increased levels of well-being. Currently, there's so much concern about current levels of reading and literacy in the country that 2026 has been designated a year of reading by the government. So there are going to be lots of national initiatives to promote reading for pleasure. So this maybe is a great opportunity for you to join Bookends, our book group, which you can do very easily just by emailing the library at somersetft.nhs.uk and just asking to be sent the details about Bookends Book Club. We meet online approximately every 6 weeks. We hold our meetings online so that they're accessible to everyone, no matter where you work across the county. We're very friendly and welcoming. Our discussions are always relaxed and enjoyable, even when we're discussing a book that we have very varied opinions of. And the book choices are voted on by all the members of the book club. We vote on them in December each year, and we actually set our calendar for the following year so everyone knows what dates the meetings will be and what the book is that we'll be discussing. Because again, we sort of realise that with different shift patterns, not everyone can attend every book meeting. And just going on about, or just sort of relating back to the sustainability conversation, I do try wherever possible to borrow our book choices from the public library so that we're not buying new books every time. We're trying to be sustainable with the book club, and also it stops cost being a barrier at a time when we know that financial constraints can be quite high on our colleagues. So, again, if you're interested in talking about books with fellow bookworms who work across all departments in the Trust, do get in touch. And in subsequent podcasts, we're going to have sort of short book reviews or book recommendations. So if you know of any books that you think that we should all be reading, again, please do get in touch and tell us about them.
I'm very excited to join. It's been on my to-do list to join, but I think this is the perfect time. I'll reach out to the library. I mean, Brilliant. I'm a librarian, but still.
We will look forward to welcoming you even to the meetings, McGann.
Perfect. So we often get some frequently asked questions, and one of these is about access. So staff and students can access the libraries 24 hours, 7 days a week. At Yeovil, it is with a swipe card of your staff badge, and at Musgrave, there will be a door code, which you can get for out of hours from the library. Otherwise, during operation hours, the doors will be open, and you can just come on in and say hello. And we're a really friendly team, so we do hope that we see your faces in our spaces. And that rhymed, and I didn't mean it to, but there you go.
Excellent. So one other feature that we're hoping to hold regularly, and it's an area that we're all very, very passionate about here in the library, it is about research activities going on across the Trust. So we're going to have a little research spotlight in each episode, and this time we're just going to talk very briefly about the Chief Nurse Research Fellows scheme that runs each year in the Trust. Despite the name, this is a scheme that's open to nurses, to midwives and to the allied health professions. It's aimed at colleagues working usually at band 5, but sometimes at band 6, who are interested in getting involved in research activities, and the scheme provides support for a year-long sort of training to run a service-based evaluation project. And our third cohort of Chief Nurse Research Fellows completed their projects and presented their final service-based evaluation projects at the end of September. So we're just going to say a massive well done to Anna Maria, to Anju, to Becky, to Janine, to Patience and to Vicky. And we're looking forward to seeing where your research develops, how you continue to improve clinical outcomes for your patients and we're looking forward to supporting you and to any other research active colleagues with the evidence, the knowledge management, the knowledge mobilisation that you need as you progress your research careers. And I'm going to hand back to Megan to wrap up the podcast.
Yeah, we really hope that you enjoyed listening to Library Lights. It was our first episode, so we're really keen to hear any feedback or any questions or any comments you have for us. So please just email us. So listen out for our next episode, where we will bring you more information, hopefully during the month of knowledge mobilisation. So thank you very much for listening, and we hope that you have enjoyed it, and we hope to hear from you soon.